We work with local schools to share ideas, knowledge and expertise in regards to offering positive food and nutrition learning experiences via the school garden. This project's been delivered for over 7 years. We've regularly provided professional learning workshops, resources and support to local primary schools. We were very happy that we were able to maintain this engagement throughout COVID-19 and the restrictions to face-to-face networking with local schools. And more recently, we worked in partnership with Rumballara to provide 5 Harvest for Health grants awarded to local schools. All of these schools delivered really positive food and nutrition learning experiences for their students via the school garden. We were able to develop case studies from this work and demonstrate evidence of the positive impact for students. So that included cross-curricular learning activities, the excitement and enthusiasm of tasting different types of fruits and vegetables, and it extended to student leadership and the connection that students had with the garden and with the staff. So we found that students were using this space in the garden as a place for reflection, and the teachers reported that it really promoted a sense of well-being for the students. I think we are seeing more and more that these types of experiences, these hands-on growing and tasting experiences for students and learning where food comes from is a really positive way of creating that tangible link between the food we eat and our bodies.
The Get Active initiative is a partnership between us, Central Coast Local Health District, and specifically our health promotion team, but also the Office of Sport and Central Coast Council. The Get Active project initially focused on the San Remo and Blue Haven areas, and the reason for this was the area has a higher rate of long-term health conditions, higher unemployment rates, and has a larger Aboriginal and Torres Strait Islander population. So what we did is put on a calendar, a month-long calendar of events and opportunities for people to get active in San Remo and Blue Haven. And this covered 155 activities, many of them offered for free or at low cost, most of which were offered and inclusive of those with a disability. And it offered activities that were suitable for a range of ages, abilities, at different locations and different times and dates. We surveyed the community after the month of activities. We found that around 50% of adults increased their physical activity, around a quarter of children did. We also found that more than 70% of people surveyed took part in other activations that weren't necessarily offered as part of the Get Active initiative, but because of the promotion of Get Active, they became more aware of the importance of being physically active. People also reported sleeping better, feeling better, and just generally feeling healthier as well. The thing that we're most proud of about this is the legacy that Get Active has created. So around 80% of the activities that were offered during the month are continuing, and that's what we wanted to see. We're seeing these activities continue to be offered in the community at reduced rates to get people involved and continue to be active and healthier.
So the project's called Activate Your Space. It's a place-based approach in San Remo and surrounding suburbs. The aim of the project when we started was to activate the space, so to get people in San Remo and surrounding suburbs physically active, and that was the reason for the park run. But evolving from that, because we developed the partnerships with the local community and we started to hear what the local needs were, the project evolved into other areas, and as one initiative occurred, it kind of opened doors to other things. So an example of that was Lunchbox Connection, where we were working in primary schools and started working more with Aboriginal communities, and that opened doors to Healthy Jarjums, which is a childhood screening program for Aboriginal children. In terms of activating the space, in terms of the park and the pathway, we can see that there's more people in the park, there's people still going to park run, there's a sense of community. The space is more utilised, there's a greater sense of safety because of that passive surveillance of people being in the park. You know, the shops near San Remo, they've even been activated in that they're full. There's a new pizza place, pizza in the park, because the park looks great, everyone wants to go there now. I think the project team's probably most proud of the way that they've really been able to stick with that community and develop those connections and develop those partnerships. I think that's the thing that people probably take away from it the most. I think it means that we have a different way of working with communities, that we don't just need to be focused on a settings-based approach of working in schools or health settings or workplaces, that we can find a way to work more locally in communities that do need a more targeted, intensive approach.